Charlotte's always been a typical kid, but she started having issues swallowing, and she complained about stomach pain. Occasionally she would have diarrhea, other times constipation. I was worried, so I decided to contact a GI specialist at the surgery center. We scheduled an outpatient procedure to figure out the best way to help Charlotte. We chose the surgery center because they have an excellent group of specialists. It's an easy drive to Franklin, and it's a way more personal experience than the bigger hospitals in the area.
Charlotte? Hi, how are you?
Our goal is to make sure everyone is comfortable when they come to the surgery center. For procedures like Charlotte's, we're able to prep, perform the procedure, and recover the patient all in the same area. Outpatient procedures typically take about 3 hours, and the patients are in a dedicated area the entire time they're at the surgery center.
Everyone at the surgery center was really nice. The nurse explained what they were going to do and made me feel comfortable. They even gave me an iPad while I waited.
Obviously, Charlotte wanted me to stay with her, and it was just as important for me to be by her side for as much as the day as possible. It was really convenient that everything takes place in the same area, and that we didn't have to walk from unit to unit like in larger hospitals. Dr. Mayer and his staff really put us at ease. He came in prior to the procedure and explained everything that was going to happen.
Well, that's okay. I can totally understand that, and I want to assure you that you're not going to feel any discomfort at all while you're asleep. I try to create a sense of comfort among the kids because this is something that they rarely experience, and most of the time they're dealing with fear of the unknown. So I try to relate the experience to something that they might have experienced before, like going to sleep, taking a nap, waking up, and then feeling perfectly fine.
Okay, Charlotte, here we go.
We have a very good staff of nurses and anesthesiologists that provide the kids with a sense of ease and comfort.
Okay, Charlotte, we're gonna hook you up to our monitors here, okay?
And I try to provide the patients with the idea that this is going to be an easy thing to do. They'll come and they'll go, and they'll get their procedure done without any trouble.
Anesthesia is tailored towards each individual patient. We want to make sure that the child and the parent both are comfortable.
The outpatient setting is a very safe area for kids to have procedures. Studies have shown that comparing hospitals to outpatient setting, there's a very similar rate of complications, which is very low, and we have fully trained anesthesiologists, nurses, and myself, pediatric gastroenterologist, that would operate in a very similar fashion as we would in the outpatient setting in the hospital. First of all, she did fine. No problems with the procedure at all. It's, I think, preferable from the standpoint of convenience and also from the standpoint of cost, which is important these days.
Our nursing staff here at the surgery center is able to dedicate a lot of time to our patients. We'd like them to come out of anesthesia feeling comfortable and have the parents join them after the procedure as soon as possible.
I'm so happy we chose the surgery center for Charlotte. They made her feel so comfortable, and it was a very positive experience. My daughter is acting like herself again, eating normally and full of energy.